Hey ladies and gentlemen, this is Isaac. So this will be my final entry on my ACL and meniscus surgery recovery. So as you guys know, I'm 43 this year, and about 1.5 years ago I had my ACL surgery and meniscus surgery. I tore it in year 2015, so almost 10 years ago. I tore it during a wrestling practice. I ignored it. I let it heal on its own without replacing the ACL until 1.5 years ago, where the doctor finally told me that after an MRI scan, they saw that the unstable knee caused by the absent ACL is causing slight arthritis in my thigh bones, so in my knee joints. So in fact, the recommendation was to get the ACL replaced, and because the meniscus was torn together with the ACL during the wrestling practice, and after all these years of the unstable joint, it is one part of the meniscus was very worn out. So during the ACL replacement surgery, the doctor sewed whatever he could back and trim off the rest of the meniscus. And so my meniscus is compromised. It's back. At least there are no frayed areas, but it is pretty worn. So I started with a new ACL and this meniscus. A year and a half ago, I have been doing monthly or weekly video journals. I stopped after coming to, I think, after 6 months or 7 months, I can't remember. So an update at year one. So I wanted to do a video at year one, but I was busy training and this live, and so this is an update for the first year, 1 year after the surgery. How's the recovery like? And then after that, I will update how I feel right now. So right now is about 18 months, a bit more than 18 months, 20 months to be exact, but let's count it as 18 months, right? So after 1 year, I'll start with the stretch. So basically, during the ACL recovery, I put it as the 3 S's: stretch, strength, and strain. So basically, stretch means how much you can straighten it and how much you can bend it. What I did for my entire recovery was I had to, once the swell goes away and I could put weight on it, on my knee. The main thing the doctors and the therapists advised on was the stretch. So you have to achieve at least pre-surgery mobility as much as you can, right? And that's the thing that most people don't get back to. So what I did was I had to straighten my leg. If I imagine this is a knee joint, I had to straighten my leg and hang some weights, maybe about 5 kg of weights on it for an hour, just to get it to be straight. And then I had to kneel on my own knee, and I do a ass to grass squat, like an Asian squat. I could do that before my surgery, so I wanted to get back to that place. So I have to say, after 1 year, the straightening was okay. So I could stretch 100% and even hyperflex a little bit. So my knee goes a little bit even more than fully stretched, fully straight. With the bend, however, the flexion, I can't immediately go into an ass to grass squat. I have to kneel on it for like 15 minutes and then try and squat for another 10 to 15 minutes before I can get to that position. All right, so that's 1 year. Strength is 100%. I think strength is probably something that most, at least for me, I was scared of losing strength, because you literally see your muscles waste away after 6 weeks of not using your leg muscles, on the knee that has gone through surgery. So you see your thigh muscles waste away, your calf muscles waste away. So that was the thing that I worried about the most. But I must say that strength was the thing that came back the fastest. So by year one, I could do squats 100% of my pre-surgery weight. So it's about 90 plus 100 kg back squats, about 80 front squats. So strength was very good. Now the last, okay, if you talk about like single leg squats, so you think about, now how about strength on just one leg? I would say this is then related to the strain. So I define strain as the pain that you feel, right? So up to about year one, every day the pain goes away slightly. All right, so every day you feel a little bit better, the knee feels a little bit better. But of course, I go back to quite hardcore training, right? So I train about 2 hours a day, and sometimes training involves running, skipping. So I do a lot of track and field skipping drills. I will post a video of what I have been doing for the past 6 months. So from year one to now, so about 6 to 8 months has passed. You would see I do a lot of skipping, because the same problem I have had since before the surgery, post-surgery for many months, is that final straightening of the knee, especially if I am on one leg. So just think about a very slight dip and straightening. This straightening, I feel quite a lot of strain and pain in my knee. So actually this little motion is what you have to do when you jump, right? So that is why I took on to, after year one, where the pain was bearable, I started to do a lot of skipping, bounding, and I even took out swing dancing, just because I wanted to, be hopping a lot of, hopping for an extended duration of time. So this was still giving me problem, and even after a year. Walking long distances, dancing still gave me aches, especially if I do it for, let's say, two hours, right? So there are good and bad days. Some days, if it's good, then it doesn't give me pain after the activity, and the next day I could do it again. Some days, right about after 1 year, even some days after running or after one of these swing sessions or skipping sessions or bounding sessions, I can feel really enough strain that discourages me to train again, right? So there were good and bad days. And of course, when you get better every day, your morale and your motivation gets higher. And then the bad days are when you feel, oh man, I feel the strain that I had like 2 months ago. Why? This is when you kind of feel, I kind of feel at least a bit discouraged. But the good news is, so I'm gonna now move on, right? So the good news is, it keeps improving. Your situation gets better. My situation got better and better even after 1 year. So according to my knee surgeon, a lot of patients, they have described that your knee keeps improving until the second year. So 2 years post surgery, it will keep improving. And then what he said was, after 2 years, the improvements will drop off. But if you still keep an active lifestyle, you know, strengthen and stretch, your condition will be continuously improving. So at 1.5 years, so I'm at 18 months. No, I'm at 20 months. So from about 18 months, I felt that every day it's still improving. And even now, I might go for a run last week, and then after the run, I feel my knee is giving me some kind of like strain, right? Just a little bit of strain. And then, but this week I might go for the same run, and the strain is much lesser, or there might be no strain at all, right? So the stretch is 100%. Even so I have now. I used to use the weights to straighten my knee, and I have gotten enough confidence that I could stand up immediately. I have straight. I can straighten my knee on the knee that has surgery, and it's as straight as the normal knee. So right now, what I do is I just hang the weights maybe once a week, just to make sure that, you know, I keep it going, and I do it a much lesser time, right? I used to do it for 1 hour. These days I do it for 15 minutes, right? I do feel the bend, the flexion. It's much better than a year ago, than 6 months ago at year 1. Now I can, without much of a warm-up, go to S2 grass, but I still feel like, okay, there is some strain there. So what I still do is maybe 3 times a week, I would still do I'm still do my full kneel, butt to ankle kneel, and then deep squat for 15 minutes, just to press on it and keep the flexibility. But I can do S2 grass squats anytime. Strength is 100%. It's more than 100%. You would see in my video. And for strength, I've been doing a lot of Olympic weightlifting, so snatch, clean and jerk, a lot of squats. It's very, very good exercise. Fully recommend. Strain now. So strain, as I say, it keeps improving. Again, there are still going to be good and bad days, but you will feel. At least I felt that the good days are more and more, and the bad days are lesser and lesser, less frequent. So yeah. For example, today. I just completed a aquathlon, right? So I swam for about 750 meters, and I went for a 5 kilometer run, and I was able to do the 5 kilometers at 23 minutes. Okay, it's not amazing time, but you know, the run itself, I used to, just maybe 2 weeks ago, I would feel like, okay, I can run. But maybe the first 500 to 1 kilometer, I keep it slow. I control my pace so that my knee is warmed up. And then once I get into a nice rhythm and momentum, then I can run at the pace that my fitness allows me. So my knee will limit me for maybe 5 minutes, 5 to 10 minutes. Then I feel safe enough to run, all right? So that to keep the strain in control, because if I just go out and do a 4 minute per km pace, my knee is not warmed up. Even though I have stretched, I've maybe do some light jogging, it's still not warmed up. I can't go into that kind of pounding and running power immediately. But today in the race itself, I felt that I could. When I started running, I was thinking, okay, I'm gonna warm up a little bit. I'm gonna keep it slow, but I felt no strain. So I just went as fast as my current fitness allowed me. So that was good for me. You know, hopefully moving forward, this is going to be how I can run, right? So without thinking so much about the knee. So right now, besides going back to full running, the skipping itself, I've been back to boxing. So boxing, we do a lot of skipping exercises. I still feel like, you know, when I can do one-legged skip on my non-surgery knee, and it's very like no problems at all. When I try to do one-legged skip on the knee, on my formerly injured knee, I could do it, but the strain sometimes is there. It's like I gotta be careful, and the rhythm is much slower. Okay, so I can't bounce as fast. Again, it's getting better. All right, so I think this is still work in progress. Hopefully, at year 2 and beyond, it keeps getting better and better, and that one day I can do like a fully explosive extension and jump with this left knee, as much as, you know, I can do it with the normal knee. I'm going back to Muay Thai, I'm going back to wrestling, as you will see in the video. So in my mind, I mentally declared that I have completed the recovery process at 18 months. So 1.5 years, I'm done. I can treat it as if this is a normal knee. I haven't been through any surgery, and of course, I'm much more careful now. So for example, I don't schedule 2 days of back-to-back runs. So I don't do a Monday, Tuesday, run. I do a run on Tuesday. I can go up to 10 kilometers. Then I rest a day, and then the next day I run again. No. So I think this is how I will train from now on. I'll continue to do the skips and skipping drills, so that I want to train the explosiveness back. Because without this explosiveness, I feel that my agility is compromised. So a lot of up and down, explosive movements. And when it comes to my left knee, my left leg being the one doing it, you know, it's slower, it's not as explosive, I can't jump as high. So I want to get that back. All right. Agility exercises, skipping exercises, fast feet, bounding. Then strength, Olympic weightlifting. So a lot of squats, a lot of horse stance, and also trying to like single leg Roman deadlifts. So a lot of care to do the movements correctly, so that I'm using a lot more of my left hamstring than my right thigh muscles, my right quads, so that I don't load the knee too much. I shift the weight back to the back of my legs instead of the front of my legs, which would then go down to the knee. So I'm really careful of that. My weightlifting coach told me something quite nice, and I try to think of this in this way now. So now I have like a super weapon. My knee is a super weapon, because my knee is telling me that my technique is wrong. So if my technique is correct, actually there won't be a extra weight or unwanted weight going to the knee, which then causes it pain or strain. If my technique is correct, my knee shouldn't be in pain or have unnecessary load. So yeah, in fact, the strain tells me that my technique is wrong. So it's good. Then lastly, I think I'm quite pleased with my recovery. There was a bit of a imbalance. So after a while, my right side, it feels a bit tense and strained, because I have been shifting my movements to the right side of my body. But you know, I've gone for a little bit of therapy and some massage, so that's good. Of course, it's something that you need to remind yourself to correct consciously. The last thing So I'm very happy with my recovery process. There's only one thing I probably would have done differently is I ignored my left calf. So I did a lot of strength work with my left quads, left hamstrings, but I did not do my left calf. So I found that it has, of course, shrunk, and it didn't go back to the same size as fast as my quads. And so there is a compromise in strength, and I found that a lot of these skipping, bounding movements, there's a lot of calf muscles involved, because you need to have like kind of like you need to stiffen your ankles for the power to transfer fully. And so if I would do it differently, I would have strengthened my calves at a much more earlier stage. And probably that's it, guys. So hang in there. I would say that of course always use your strain as a gauge. Listen to your doctors and therapists. When they say you can do it, do it. If you feel strain, if you don't give up, 1% better every day. If you feel you know your body the best, give the pain a lot of respect. If you feel strain, don't push. But again, I push through some of the strain, so I'm not the best person to say. I did an MRI. So the last thing, I did an MRI just a month ago. So the doctor wanted to see like 18 months, how did the knee look from the inside. So very happy to say, ACL, the new ACL is very healthy. It has completely integrated to my organism. So it was a donor ACL, it was somebody's ACL, and now it's completely integrated to my knee. The meniscus also, as healthy as a worn out meniscus could be, so it's good. And he did discover that I have a cyst inside my thigh bone. So the cyst is not outside but inside my thigh bone. I guess it's because at the start of my recovery process I pushed too hard, that maybe there was some unwanted stress around that bone area, so that the cyst developed. Is there anything I can do about it? My surgeon said no. He doesn't want to open up my knee to remove it. So far it's asymptomatic. It's not causing me any pain, or it's not growing bigger, or I don't know. It's not hindering my movement. So I'm gonna leave it at that. I have a good ACL, I have a good meniscus, and yeah. Thanks, guys, and message me, put anything in the comments if you need help. Yeah, good luck, guys.